Hi, I'm Alana Hippensteel from Pharmacy Times, and joining me is Dr. Jay Lieberman, a pediatric infectious disease specialist and the senior medical director of PRA Health Sciences. Dr. Lieberman was a speaker at the World Vaccine Congress in a session on COVID-19 disease and vaccines for adolescents and children. And he is with us today to discuss the future of COVID-19 vaccines in this population, specifically in light of his perspective on the enrollment of his twin daughters in the Moderna COVID-19 vaccine trial. In your opinion, what is the value of the pharmacist in administering vaccine during the COVID-19 pandemic to children and adults?
Yeah, I think pharmacists and pharmacies can play and are playing a very important role in vaccinating individuals against COVID-19. To continue the family affair here, my wife is a hospital pharmacist, and when the vaccine first got licensed, obviously she got herself vaccinated. She was first in line, but she also made it her personal mission to vaccinate as many people as possible. That meant for family members, learning the systems, and there were challenges in getting in the queue to get vaccinated at various sites, and it varied city by city, county by county, state by state. And she worked hard, including waking up at 3 a.m. sometimes to get a family member who was eligibly vaccinated, an appointment at CVS, for example. And so she made that her personal mission. In addition, she's worked well more than a dozen clinics now in her hospital, at community sites. She was at Disneyland administering vaccine. She recruited friends of hers, fellow pharmacists, physicians, nurses, to set up a clinic at the site. And as a result, I mean, thousands of people who would not have been able to be vaccinated that day were able to get vaccinated. So, when the rollout first started for vaccination, a lot of it was obviously at big pods, big sites, but it's now moved into pharmacies and finally into physicians' offices. And so improving access, and people know their local pharmacy, they go there. Having access there is a tremendous advance. We want to make it easy for people to be able to get vaccinated.
Yeah, absolutely. On that note, do you think also children would feel safe, or even, I mean, potentially not if Disneyland is the other option, but potentially safer than maybe certain mass vaccination sites at their local pharmacy versus some of these other locations?
Yeah, again, it's what's easily accessible.
Mhm.
Where do people feel comfortable? Obviously, pharmacies play an important role in vaccinating adults against influenza and pneumonia and shingles.
Mhm.
And I think COVID-19 fits in very nicely. So again, having local access, convenient access, enhances the ability for people to get the vaccine when they want it.
Right. What are your hopes for the future in regard to COVID-19 vaccine development and administration among adolescent and children populations?
Yeah. So first, I'd comment that obviously in the United States, we've made tremendous progress in reducing the incidence of COVID-19, and it's important to understand and recognize that success is almost entirely due to vaccination. So the issue we have now, one, is to increase vaccination rates among adults and now teenagers in the United States who, for whatever reason, might have been hesitant or waiting. We've got to expand vaccination to younger ages. So in addition to the 12-year-old daughters, we've got a 9-year-old and a 7-year-old, and we want them vaccinated as well. Again, vaccinating them protects them, it protects us, it protects the people we care about, and allows them to going back to doing the things that children and teenagers should do. I also just mentioned, how successful we've been in the United States. Unfortunately, not everybody in the world has access, and there are just tragedies ongoing in many parts of the world, and so vaccines have to get out to them as well. And it's not only the right thing to do, the ethical thing to do, the humanitarian thing to do, but it also helps protect us because this virus is global. And the more the virus is allowed to circulate unchecked in communities, the greater the likelihood of new variants emerging. And so, we're feeling pretty comfortable in the United States right now, and hopefully things will continue to go smoothly. But it'd be a mistake to say we're done. And again, the path out is vaccines, and it's got to be global. So, that's the hope for the future, and hopefully for the near future.
Yeah, absolutely. Thank you so much for taking the time to speak with me today, Dr. Lieberman.
Alana, thank you very much. Really appreciate it.